His hands were shaking more than mine, which, considering I was the one holding the needle, was saying something. I remember the rain that night. Not the dramatic kind, not the kind that makes you feel cinematic and alive. The quiet kind. The kind that just sits against the window like it has nowhere better to be. I was on a late shift, covering for a colleague who'd called in with what she described as a spiritual emergency, which I later found out meant she had a first date. Fair enough. I was in my second year of nursing practice, still learning that confidence isn't something you find before the moment. It's something you build inside it. He came in around 10 in the evening, maybe a little after. Tall, a little rumpled, wearing a jacket that looked like it had been through something. His name was, well, let's call him Marcus, because that's close enough and he deserves a good name. He sat down across from me in the intake area and immediately said, "I have to warn you, I pass out." I looked up from my clipboard. "From needles?" I asked. "From the word needles," he said. I appreciated the honesty. Most people wait until they're already tilting sideways. He needed an intramuscular injection, a vitamin B12 complex, prescribed by his doctor for a deficiency that had been making him exhausted for months. Not a dramatic diagnosis, not an emergency, just a tired man who needed something his body had stopped making enough of on its own. But for him, that syringe on the tray might as well have been a small personal catastrophe. I pulled my chair a little closer, not too close, just enough to lower the temperature in the room by a few degrees. "Tell me something," I said. "What do you do?" He blinked. "What?" "For work. What do you do?" He said he was an architect. He designed staircases specifically, which I found quietly wonderful. Just staircases. The way people move between levels of a building. He said most people don't think about them, but a good staircase can change how a whole space feels. "Huh," I said, and I meant it. I think about that with veins, actually. He looked at me like I'd said something mildly alarming. "The way they run," I said. "The pathways, how everything connects." He was still watching me, but his shoulders had dropped maybe half an inch. That's all I needed. Here's what I've learned about nervous patients, and I mean genuinely deeply nervous, not just mildly uncomfortable. The worst thing you can do is make the procedure the center of the universe, because in their mind, it already is. It's a black hole. Everything is getting pulled toward it. Your job is to put something else in the room, a conversation, a question they actually want to answer, something that makes them the expert for a minute instead of the patient. I had him tell me about the worst staircase he'd ever seen while I got everything ready. He talked. I listened, genuinely, not performatively. And while he described a spiral staircase in a building in Portland that was, apparently, a structural insult to the concept of upward movement, I was checking the syringe, confirming the dosage, uncapping with one smooth motion, keeping everything just slightly out of his direct line of sight. The injection site for intramuscular, for anyone listening who's curious, when we're talking about the deltoid, which is the muscle on the upper arm, we're looking for the lower edge of the acromion. That's the bony point at the top of your shoulder. You come down about 3 finger widths from that landmark, and you're in the safe zone. The muscle there is thick enough to absorb the medication, and you're clear of the major nerves and vessels that run closer to the armpit. I asked him to roll up his sleeve. He did it slowly, like a man who's been told to walk toward something he doesn't want to walk toward. "Keep talking," I said. "The Portland staircase. It had no handrail on one side," he said, and his voice was doing that thing voices do when the body is tensing up, going just slightly higher, slightly faster. I put on my gloves. There's something I've always liked about that moment. The snap of nitrile, the way it changes the texture of your hands from person to hands that are about to work. It's a small ritual. It means we're beginning something together. I clean the site with an alcohol swab, circular motion outward, let it dry for a full 10 seconds. People skip that drying step constantly, and it matters. Wet alcohol on the skin can cause a slight sting that patients sometimes mistake for the needle, and then they flinch at the wrong moment. Let it dry. 10 seconds. It costs nothing. No handrail, I said. That sounds like a lawsuit waiting to happen. He laughed, short, surprised, and in that exact half-second of relaxed muscle, I inserted the needle. 90 degrees to the skin, smooth and confident. Not fast, but not hesitant either. Hesitation is what causes pain. The muscle doesn't mind a needle. The muscle minds uncertainty. I aspirated briefly, just a small pull back on the plunger to check we weren't in a vessel, and then I administered slowly. Steady pressure. The medication went in over about 10 seconds. He didn't flinch. He didn't even realize it had happened until I was already withdrawing and pressing a small piece of gauze to the site. "Wait," he said. "Done," I said. He looked at his arm like it had betrayed him by not performing its usual drama. That's it? That's it." He sat there for a moment, genuinely recalibrating. I kept the gauze in place, gentle pressure, just long enough for the tissue to settle, and told him to stay seated for a few minutes. Not because of any serious risk, but because after the adrenaline of anticipating something terrible, the body sometimes needs a moment to remember it's fine. I mentioned to him, while he sat there looking quietly victorious, that the B12 deficiency he was dealing with often shows up as more than just fatigue. Tingling in the hands or feet, a kind of brain fog that makes it hard to concentrate, even some mood changes. A lot of people live with it for a long time before they connect the dots, because it creeps in slowly. If he was still feeling that way after a few weeks of treatment, it was worth going back to his doctor to check his folate levels too. They work together, and a deficiency in one can sometimes mask a deficiency in the other. He nodded, absorbing that. Then he said, "You know, I almost rescheduled tonight." "I know," I said. "Most people do." "What made you... How did you know to ask about the staircases?" I thought about it for a second. The rain was still doing its quiet thing against the window. The hallway outside smelled like it always does on a late shift. Antiseptic and old coffee, and something faintly floral from the hand lotion someone had left at the nurse's station. "I didn't know," I said honestly. "I just asked what you loved, and then I listened." He smiled at that. A real one. The kind that takes up the whole face for a second before it settles into something quieter. He rolled his sleeve back down, buttoned his cuff with steady hands, and stood up. "Thank you," he said. And then, because he was apparently that kind of person, he added, "I hope whoever designed this building's staircase knew what they were doing." I looked down the hallway, the long, slightly scuffed linoleum corridor with the fluorescent light that always flickered near room 12. "I think they did okay," I said. He left. The rain kept going. I wrote up my notes, refilled my coffee, and went back to work. But I thought about staircases for a while after that. The way people move between levels. The way a good one makes you forget you're climbing at all.